apologies.
Okay, it worked. Wow.
Oh gosh, technology is not my forte. So it
Same. I was
sometimes so happy to have you on. I kind of gave an intro in my last, I logged on and then logged back out thinking it was me just being silly, but we're here now.
okay.
So
Great.
I'm just going to introduce you. So this is Dr. Ophelia, and something that you perhaps don't know is that Ophelia and I went to university together. So we actually do know each other from before, and we bumped into each other at an event a few months ago, and it was so good to see you, and that too in the sort of same field, which was really really nice.
Yeah.
And at that point I thought, right, we've got to get together and talk hair because of your expertise, and here we are.
You cut
So
out.
oh, can you hear me? Can you hear me?
Yeah, you cut out. You just cut out.
Oh, okay.
Yeah.
um So Dr. Ophelia is a consultant dermatologist in London, and she is both NHS and private, but her expertise lies also in hair. So you run a tertiary hair clinic at UCL,
Yeah.
is that right?
Yeah.
Which is why I wanted to have a chat with you, because I get so many questions on my page about hair and hair care and
Mm.
all sorts. So I thought I'd bring you on and we can talk hair and bust some myths, because there's so
Yeah.
much information out there and it's so hard to sift through what's right and what's wrong. um so yeah, are you ready to go?
Yeah. I'm just reading some of these. Just reading some
Comments.
questions.
Okay, so I thought we'd start by just sort of doing a five rapid fire questions just to get the sort of questions flowing.
Yeah.
So the first question, and one that was asked a lot on my page, was, does the hair fall change during the menstrual cycle?
Not significantly. It's
Okay.
it's it's normal to have 100, 150 hairs fall a day, and
Okay.
which surprises people, but not significantly on a month to month basis.
Okay, so you wouldn't expect, pre-period for that to change. So
No.
100 to 150 is about normal, and that actually sounds like a lot, and it is a lot,
Mm.
because actually when you think about 100 hairs, 150 hairs, people always show us pictures, don't they? They say sort of, oh look, this is what was in my drain, or this was in my brush, but actually 150 hairs is not is
Yeah,
normal.
I mean, that's what the textbooks say, but yeah, I mean, these are very old studies that were done, and that apparently is normal. But in clinic, we do something, a hair pull test, where you go like this, and if you can feel the hair easily coming out, that means you're shedding.
Right. Okay. Okay. So, and of course that will change now, because we do different hair styling techniques as well. So we probably lose a bit more. I certainly lose a bit more when I tug and pull my hair, and so there's a different. I guess we've progressed a lot as well in hair styling. Second question is, my doctor always tells me to start minoxidil. Does it work, and will my hair start falling out when I stop using it?
Minoxidil does work. It's a very effective hair growth agent, and you can take it, you can get it in Boots. You can buy it online, and also you can take it orally. It's very effective orally, but then you get hair growing everywhere. So,
Yeah,
you
yeah. You do
need
have
to
to
be.
be careful of even when you apply it topically, right? Like you
Mhm.
can end up with hair
Yeah,
growth
so don't
in
put
really.
on at night time, and then it can come off like just before you go to bed, because then you can start getting hair growth on your face. So you've got to be careful about that. So honestly, about the question about the hair falling out if you stop using minoxidil, I get asked that nearly every day. I think it's a marketing myth that came out like in the 60s or 70s, because I've got patients that have used minoxidil for years and stop it, and their hair doesn't fall out. It may over
That's
time
really interesting.
regress a little bit, but you don't see this, oh, I stopped my minoxidil, I started shedding a week later. It just doesn't happen. I think it's a marketing myth to get people to keep buying, buying,
To
buying.
keep
But actually,
buying it.
but if it works, and so for the people who it does work for, who is the majority, you would really want to continue using it, wouldn't you? So,
Well, yeah, I suppose you're seeing the
mm,
benefit when you're using it. So it's not, I think also it's important to say it's not going to get worse than it was. Because I think some people also feel that if they use something like minoxidil, that their situation will, when they stop using it, it'll be worse than what they started off with, which isn't also true, is it really? So,
Not really. And sometimes people don't see that it prevents things, minoxidil or hair growth treatments at work. They can stop things from progressing, and people don't know what they would have, what situation they would have if they weren't using anything at all. So,
yeah. Okay, so that's great. So minoxidil does work, guys. They don't. It's not a myth. So what would you say? And I get postpartum questions a lot. What would you say are your top 3 tips for postpartum hair loss? And I'm really keen to hear this as well. What you think about this?
it's a normal part of giving birth. Tends to be around 3 months after giving birth. And I tell people can get really, really distressed by it and upset. And I tell my mums to enjoy their baby, don't worry about their skin and their hair. And once it's all over, it will largely recover by itself. And if it doesn't, we've got really good treatments now that work. But it's really, and I think once you go through that in a very detailed manner and explain to people exactly, well, when you stop breastfeeding, when you're in kind of a state to come back for treatment and things, because it was most women at 3 months when the shedding starts don't particularly want to come in for treatments and things. And if you go through, you can do option A, B, C, explain it properly. They understand that and they go away, and that relief of things being explained properly can help a lot as well. So just not to worry about it, enjoy the baby, and all of these things can be sorted out later.
Yeah, I suppose what I would add to that is that postpartum period is you're very, I don't want to say the word sensitive, but I think everything is heightened.
Yeah.
And I think that you're feeling, emotional, probably possibly more emotional than you would normally. And so losing hair can be that much more emotional for you. And what I always say to the women is, it is like you say, it's normal and it will come back. On the rare occasion where it doesn't come back, you must seek. And at what point do you say to women, right, if it doesn't come back by X amount of time, what point do you sort of tell them?
Well, when I see them postpartum, I think it's really important to go into the family history. And if there is a strong genetic or hormonal tendency, so if they had polycystic ovaries or any other kind of hormonal tendency for hair thinning, I would try to get them to start treatment fairly early on. Because what happens when you go through a shedding episode due to giving birth, poor health when you're younger, if genetically you had a tendency to thin, say in your 40s or 50s, it could be happening in your 20s or 30s. And we see this quite a lot, particularly post-COVID shedding as well. So then I would be more inclined to say, let's not wait to see if it will grow back. Let's just start treating that underlying tendency that you have with the more targeted treatments for the hormonal and genetic hair thinning.
Right. So taking a really good history from the clinician is really important, and sort of delving into the history, both past medical history, but also family history. Okay. Family history. Yeah. Yeah.
And also hormones. Make sure that they know if they're put on a hormonal coil or oral contraception, that certain ones can accelerate the hormonal hair thinning.
So we're talking about progesterone only contraceptives.
Progesterones all have got an androgenic potential, so a testosterone-like potential, and they've got different grades of them. So you've got to choose carefully which one. Copper coil is really.
The copper coil is best because it's localized and we're not seeing as much systemic. The IUD. So the IUD doesn't have any hormone, but more often than not, we are offering women the Mirena coil, which is, obviously got progesterone in it. So that's what Dr. Ophelia is saying, is that you if you opt for non-hormonal contraception, then that's less likely to meddle with your hair situation.
Yes.
Okay, so what is the number one cause of hair loss that you see in your clinic?
Number one,
Okay,
it's
number
probably,
two
yeah,
most
it's
common.
probably split between the two conditions we've spoken about. So telogen effluvium, so the stress, COVID, birth-related shedding, and then secondly, the hormonal type of genetic hair thinning called female pattern hair loss or male pattern hair loss or androgenetic alopecia. There's different names. Those are the most common. And the less common, we've got autoimmune and inflammatory conditions, so alopecia areata and lichen planopilaris, but they're quite rare actually. I see that
Yeah,
more in my NHS.
in your NHS. Yeah. And so what sort of different patterns do you see with, say, for example, with the postpartum? Do you see any differences in the type of hair loss women get between that and the sort of androgenetic kind of female pattern hair loss?
Oh yeah, so it presents completely differently. So when people are shedding either postpartum or due to other causes, they very typically come in and explain, they've got my hairs coming out in the shower and on the pillow and on the floor. They can be quite tearful and quite stressed. So it's all in the history really. And
Hmm.
then the androgenetic alopecia is more a gradual hair thinning that you see with time.
And you tend to see it more at the front or all
Yes.
over?
Yeah, so with men, you only see it at the front and the crown, and you
Hmm.
don't see it at the back because men don't have testosterone receptors on the hair follicles at the back. So that's why those hair follicles are protected. The causes of female pattern hair loss are more complicated. We don't fully know. It's partially related to testosterone, but not fully.
Hmm.
And you get what we call hair follicle miniaturization. So when we look at with the dermatoscope at the hair follicles, so when you're younger, all your hair follicles are the same diameter. And what
Hmm.
happens with the androgenetic alopecia is some of them become what we call miniaturized. So not all the hair follicles, but some of them become thinner. So you don't
Yeah.
lose them. It's just that some of the hair follicles become thinner, and that gives the appearance of hair thinning. And with women, so the first signs of that condition is that you will get it on the temples, and then a really
Mm.
sign, if people have got really the beginning of the condition, what you do is you get them to do a central parting, get them to
Hmm.
down, and you say, is that the kind of amount of scalp that you could see in your central parting? And that's one of the most sensitive signs of it beginning, if you don't have a dermatoscope at home, because not many people do.
Of course. Really helpful. So the size of so the way your parting looks, and that could be in the center or off center, where you regularly part your hair is
No,
where
no,
you'll
central parting. You want to put it
central.
in,
Okay.
yeah.
Right. Okay. Okay. So it has to be in the middle of the head. And where would that normal for you, for you as an individual? If it starts to look wider, that's when you would sort of.
Yes, yeah. Because also, many women have got thin temples since that they were young, and there's nothing wrong. But if it's looking thinner, then that's a point where you would start treatment. And it's the same thing with the central parting. But you see the wide, we call it a widened central parting, and you tend to see that first.
Okay. Okay, that's really useful. So the final question is a funny one, and I think I know the answer, but I'll ask you anyway. Is there a cure for graying hair or your hair turning silver, as I like to call it?
No, that's one Nobel Prize waiting to happen. So we it's very genetic. It's caused by, so the melanocytes sit at the bottom of the hair follicle, and they produce pigment, and that pigment goes up as the hair follicle grows. And what happens is, as you get older, those melanocytes start to get tired, and they kind of die off one by one. And
Yeah.
it's very genetic.
And
To speak to parents about what age they went to. There is some weak evidence that minerals such as selenium can be helpful,
mm,
but I'm not
yeah,
I'm
I
not
read that.
it's that if you take selenium, your hair will stop going white. Just got to
Yeah,
find a
and I think got to find a what? A good hairstylist, did you
good
say?
hairdresser.
Yeah, exactly what I've done. and I think that brings us nicely onto supplements. And I wasn't going to talk about it right now, but I think it's important if we talk briefly about selenium. And one of my issues with talking about supplements in any context, whether it be hair or skin, is that people can take it out of context, and that, you know, what we don't want is people to go out and buy supplements that they think is going that I think they think are going to help with their hair, and actually there's very little evidence for, and actually then run into problems like toxicity and things like that, so, or side effects. So what are your thoughts on supplements when it comes to hair loss specifically?
So we know that certain vitamins and minerals are needed in the high normal ranges or slightly overshot. So they are iron, zinc, B12, folate, vitamin D. Really, the most important are iron and zinc, and possibly vitamin D. And they're important if you've got another cause of hair loss that you're having treated. You've got to have those base level nutrients. But in the Western world, you just don't see deficiencies that are that low that are causing the hair loss or hair thinning.
Yeah.
So you've got this massive industry that's got out of hand, which almost promoting that if you take these supplements, your hair will grow and it will thicken, and it's just not the case. However, when you go to a dermatologist and get your treatments for your hair loss or hair thinning, we will make sure that those nutrients are at an optimal level. But if that's the only thing you do, you're not going to see results.
So you're saying, basically, is what I say to my patients as well, is that we want to just kind of take it out of the equation. We want to make sure that that isn't an issue, which it's unlikely to be anyway, but also you want to create an optimum environment for all of the other treatments to work, whatever treatment we're giving or doing.
And a lot of the supplements are not formulated by people who actually treat hair diseases. So so it's kind of a bit of a bandwagon, you know, biotin, there's no evidence that it helps. It can cause hair shedding, and it can interfere with a very important blood test that's very sensitive for heart attacks. So troponin, as you will know. People taking biotin for hair supplements. So, you know, it can get, and there's an FDA warning against having biotin in supplements, but they're still everywhere because you can't regulate these supplements because they're seen as being food. So anyone can sell what they want.
Exactly. And also the concern is obviously how does one know how many to take all at once? Because, you know, you might take more than one type of supplement, and those two supplements could contain biotin, and you're then running into problems with overdosing in that particular supplement. So guys, it's really, really important to make sure that, you know, you're not doing that, and if you do hear of somebody bulk buying any supplements, then, you know, do let them know that.
Sorry, one important thing about supplements is that the whole concept of a hair multivitamin is flawed, because the two most important vitamins are iron and zinc, and they need to be taken separately. If not, they don't get absorbed. So
okay, so that actually was something that you highlighted to me, and I wasn't aware of. I always tell patients to take it separately anyway. But the bulk of the ones we buy over the counter contain the zinc and iron together, don't they? Right. And what you're saying is that you need to take them separately. But you have your own range as well, don't you? Do you not vitamins, or is it just
no, it is. It's basically, for years me and my colleagues, we write the same list of vitamins out, and it's just a morning tablet and a night tablet. And I tell my patients, if you don't want to buy my vitamins, because we've got to be ethical about this. Like, you know, or go to my website and have a look at the formulation. It's written there. And if you don't want to get mine, you can just copy it and buy those concentrations from Holland and Barrett. And you don't need to do all of them. I would just say iron in the morning. So around 20 milligrams, things with, when it's mixed with vitamin C and folate and B12 and things, then it all gets absorbed better. And then at night time, zinc about 15 to 25 milligrams. And then if you throw in some vitamin D, about 1500 is a good dose for most people, it doesn't matter whether you take it morning and night. And I think that's pretty much what you do. I think that's a good like you don't really, if a patient comes to me on that, I wouldn't recommend them to take my supplements or do anything different.
Yeah, yeah, and that's great advice, actually. It's really, really important. Um, okay, so I think we've pretty much done supplements now. Now, when it comes to hair and mental health, I wanted to sort of briefly touch on that as well, because I think something that I've maintained all my life is that it's not just hair. It's more than that, especially um, for women of South Asian origin as well, because so much emphasis from a really young age is put on the hair care, how the hair looks, braiding hair, plaiting hair, all of that. Do you see a lot of that reflect in your practice as well?
Yeah, it's a massive issue. I mean, um, children watch, on the Disney films, the princesses have got long flowing locks and the baddies have all got no hair. I posted recently about
I
the
saw
role
that.
the witches. So,
Yeah,
if you've got no hair, it means you're a witch. So this
yeah,
is what our children are reading and being
yeah.
exposed to. I'm Sikh, so I mean, I obviously
Oh,
cut, but so, and actually spiritually, there's quite a lot of from cultures and religions. There's a lot of spiritual attachment to hair,
yeah,
and so when people lose it, particularly women and men as well, it can
yeah,
really affect mental health. Yeah.
yeah. Mental health, and not just mental health, but also sexual health, how we feel about ourselves, confidence, personally, it can have such a big impact. So it's super important to address it, both the mental health and the hair loss together. So important to talk about it with your clinicians when you go and see them.
I
Don't shy away from it.
always kind of gauge as well. I ask people about their personal lives and how their hair makes them
Mm,
feel, particularly with men, because, if it doesn't
mm,
bother them, then don't treat it. It's a waste of time putting something on your hair or taking a tablet or coming for treatments if it doesn't bother you
mm.
and you're confident.
Yeah, absolutely.
If you're not going out or not getting into relationships because of it, then I would I would give a more aggressive treatment plan.
Yeah,
Yeah.
yeah, absolutely. Okay, so hair care at home seems to be a huge topic that's always discussed on social media. I get taken aback every time I open my TikTok with great fear which hack I'm going to be thrown. And I don't, I know, again, I get asked a lot in clinic and on Instagram, what sort of things do I do at home? And I have done oil hair massaging and hair from my own hair, my children's hair, and my mum's done it, her mum's done it.
Mm.
What are your thoughts on hair care at home? Is there anything that we shouldn't do or should continue doing that you really like outside of science? I'm talking, more of
Yeah,
a holistic approach.
there are a couple of things I think to say about that. I do advise people about the hair oiling. I know it's quite a cultural thing for us, but
Yeah.
it's kind of like putting moisturizer on your skin. It's looking after, you know, not the skin barrier, but the hair barrier. So
Mm,
as the hair grows, the cuticles kind of get lifted up, and putting hair oil on wet hair helps seal that moisture back into the hair follicle. So I do
mm,
doing that, and it helps with a lot of scaly scalp conditions as well. And
mm.
heat can be very damaging. So uh, I'm not saying don't do blow dries, but just try and limit it because it really does damage the hair. And then
Yeah.
conditioners, honestly, just use whatever you like. There's not a shampoo or conditioner out there that will make your hair grow or actually genuinely be thicker. It might feel
Mm,
thick.
mm,
I'm, speak to your hairdresser about that, about what they think is good for your hair, and
mm,
choose what you like the look of or smell of. It doesn't really matter.
mm. So yeah, I mean, I think I'm with you with the hair massage, scalp massage. Applying a hair pre-wash hair oiling is really good in my opinion because it protects the hair also from overwashing and hydro fatigue, where the hot steam can open up the hair shaft and cause damage and cause it to get brittle. So we do that regularly in my home. And is there anything in terms of like in salon treatments? There are lots of sort of heat aided treatments that people have nowadays. I personally had something called hair Botox, which is just basically a keratin treatment. It's called hair Botox, but it's not Botox at all. It's very misleading, actually, the name, but it's actually just
is it keratin treatment?
yeah, yeah. And
Generally,
is
when
there anything?
I ask about this, I say to avoid them. The reason being is that chemical and heat treatments, you can get this rare condition called CCCA, which is a scarring hair loss, and you can get this. This is in people with dark skin types, but
Okay.
even in other skin types, you can damage the hair shaft if you do it too much or if it's not done.
So specific chemical treatments, so where the hair is being relaxed, can
Yeah,
actually damage
because they've got
the hair.
formaldehyde derivatives
Yeah.
in.
So a key message here is actually formaldehyde is actually quite dangerous,
Yeah.
not just from a fumes point of view, but also damaging to the skin and hair as well. So when you're looking for treatments, and if you must have them, which a lot of us do, make sure it's formaldehyde free. Yeah. Okay.
No, but what
The next topic.
while is they put other molecules in them that are relatives of formaldehyde, and they're just as damaging.
Oh,
So it is better to
oh, don't
honestly
tell me that.
go natural if you
Go
can,
natural. Go.
and get a
Don't
blow
have
dry if you
any.
want your hair to look really good for a particular event.
So blow drying over any kind of permanent straightening
Yeah,
or relaxing.
blow drying, if it's not every other day, obviously, if it's like once every 2 weeks or something, if needed, depending
Right.
on your social life.
All
I'm
right,
gonna
you're
get
talking
in
to the
trouble.
wrong. You're preaching to the converted here because I blow dry my hair almost every other day. But yeah, I hear what you're saying, and I think that if you are going to blow dry your hair, do it on a low heat setting. You can actually blow dry your hair with cold air,
Yeah,
and I have tried it myself, and it does work. It's not as pleasant, and it's not as quick, but you can
that's
do
what
it.
on the big photo shoots in Paris for the really close up photos. It takes hours, but you go with wet hair,
Mm,
blow dry it with cold air.
cold. Yeah, because it reduces the amount of frizz, doesn't it?
Yeah.
And it's just super smooth. So yeah, blow dry your hair cold, but it's -2 outside. I don't see myself doing it at the moment, but it is the right thing to do. It is the right thing to do to not damage your hair with heat. Okay, perimenopausal hair loss, which we see a lot of, don't we? Because that is huge topic, which I talk about from a skin perspective, but from a hair perspective, what sort of, again, just 2 or 3 recommendations that you make for perimenopausal women?
I mean it's important to firstly make people aware that it's a very normal part of getting older. About 80% of women will have androgenetic alopecia by the age of 50. So it's important not for women not to feel that there is something wrong with them because they're getting thin in hair. And a lot of women who associate their own beauty with their hair, it's really difficult for them the first time in their life
Yeah.
to start thinning. But again, there are treatments that work, but
Mm,
also particularly perimenopausal. Again, I might get into trouble
mm,
for saying this, but there's very kind of trigger happy prescribing of HRT, and if you need HRT for a good sound medical reason, great. But if you're just optimizing levels because it's in fashion to optimize levels in certain
yeah.
places, then the testosterone and the progesterones can accelerate androgenetic alopecia. So a
Yeah.
lot of my patients come to me for the first time. We go into it a little bit about their hair. They might also have pigmentation on their skin for the first time in their lives, something called melasma. You dig a little deeper, they've just been started on HRT and they weren't told that that's a potential risk or side effect. But
Mm.
some people just need the HRT if they've,
Of
got
course, yeah.
each individual has to be treated and managed accordingly.
Mm. So I think what I say to my patients is to weigh up your symptoms against each other, and you know, and I think that what we talked about on the phone call we had was consenting patients and fully informing them of side effects, potential complications, side effects is so, so important. And, you know, I'm guilty as well, because when I have 10 minutes to do a consultation in general practice and we're starting HRT in literally 4 minutes, it's really, really hard to get across all of the potential, you know, things like, you know, I have to be honest, things like melasma
Yeah.
and a little bit of hair loss on our NHS clinic is probably not high up on our list of complications to talk about, right? So,
And people always
I,
look at me when I'm crazy when I go off on my HRT rant in clinic. So I'm like, nobody ever told me that. But the thing is,
yeah,
I don't prescribe HRT as well because it's totally out of my area of
yeah,
expertise. So it's about, you know, having a good GP and
yeah, yeah,
having a dermatologist. But I think it should be on that list of quick fire things that people get told when they start HRT,
yeah,
because
yeah,
people
and actually,
make a different decision
yeah,
about
yeah,
whether or not it's.
and I think something like melasma is so difficult to treat, so difficult to deal with, because it's very difficult to cover up with makeup
Very
sometimes.
difficult to treat.
Um, very difficult to treat. Can be worsened by holidays and things like that. Even when you're putting on loads and loads of sun protection factor, it's still it's very evident. So, you know, I think that could be a game changer for some women if they're told that potentially that is a side effect.
But then there
Um,
are ways of counteracting it. Like for the melasma thing, you can take oral tranexamic acid. It's off license, that most dermatologists would prescribe that. And then, you know, topical treatments as well, being really particular about sun protection and things. So if you need to be on the HRT for good sound medical reasons, there are things that we can do to
right.
limit the hair loss, hair
But
thinning.
just weigh up your own, yeah, just weigh up your own pros and cons and do your due diligence when it comes to what you're being prescribed, if your doctor hasn't had the time to discuss it all with you. So that takes us on quite nicely to treatments in clinic, things that, you know, can be done physically. And we talked about supplements, we talked about minoxidil, we talked about briefly about tablets, but what about procedures? Like, if, you know, if you're going to talk through somebody, you know, with hair loss, hair thinning, what sort of procedures can you expect to be offered?
So, I mean, the main one is PRP or PRF, where you take the plasma, you spin it down, you concentrate it for the growth factors, and it's injected into the scalp. Now, by itself as a procedure or even a course of treatment, it's actually not very effective. But when combined with the topical hair growth medications or one of the tablet medications, so for women it would be spiralactone, oral minoxidil for men, oral minoxidil, finasteride, all of
Yeah,
which are risks and side effects, which is a whole another live session. But when combined with one of those with another treatment, it can be very effective. So if you're putting someone on a hair tonic or a tablet, you may not see results till around 6-7 months. But when you
right.
do it in combination with a course of PRP, you tend in most cases to start seeing results by the second month, by the third month. So it's about picking which 2 or 3 treatments are best for that patient and trying to get them
Yeah,
to do.
yeah. So it can help
Yes.
it along if you want quick
If you
results, if you've got a
rapid,
big,
yeah.
yeah, yeah, quick results. So PRP is the main one. And
And hair
sort of what,
transplantation as well. But I always try to kind of do these other things first.
yeah. And so what sort of turnaround time, just so that people know if they are going to go for it, sort of how long are they, you know, to be expected to be in clinic, and sort of how quickly can they expect to be out and about doing their own thing?
Well, this is the thing. Everybody does it differently. It's not because it's something that happens only in the private sector. You know,
Mm,
there's not. I mean, who even knows about who you're supposed to go to if you've got a hair loss condition? People don't know. So you've got lots of different people in the industry saying that they're hair experts and doing things in different ways. So
mm,
I can only speak for how I do it. I do it in a standardized way according to kind of randomized controlled trials that have been done on it. And you know, you come in, I always tell people to drink a lot and, you know, take the day off work. You have local anesthetic put on the scalp. You have a couple of vials of blood taken. that gets treated and then it gets injected back into the scalp. It's quite an uncomfortable procedure, and people need to be aware of that. And then you probably want to go home and, you know, have a lie down. Um,
Mm.
uh,
So
uh,
it's not like not necessarily a lunchtime procedure that a lot of this sort of common procedures
one of
tend to be.
no,
So
one of treatments. I only take on patients for PRP if they're committed to a full course of treatment. And also, a lot of clinics out there are telling people to do it once a month ongoing, which is crazy because you can't live your life like that. And if you know, if you're really managing the patient well, you've got to get them on a maintenance regime so they don't have to keep coming back to clinic for their hair once a month, because that's
mm,
day out of people's schedule, and it means that,
yeah,
you know, it's not good medicine to be doing that.
yeah, yeah. That's a lot. A whole day every month is a lot.
It's
So they need to be.
expensive. You know, it's important to tell people up front it's an expensive thing to be doing.
Yeah, absolutely. Okay. We touched upon hair transplants, and obviously, I know you don't do that, do you? Or do you? No.
No, no,
Um,
I don't have the patience.
um, but uh, one thing that we discussed briefly was the implications of going to someone who is going to look at your scalp and look at your hair before going ahead with the implants, and why is that important? Um,
So you've got to be very sure that you've got the right diagnosis. So, you know, hair transplantation is great for men with male pattern hair loss. But if you've got one of the so if you've got alopecia areata or one of the inflammatory scalp conditions such as lichen planopilaris,
mhm,
you know, the people doing these procedures may miss that diagnosis,
mhm,
um, and so you risk. It's again, there's a lot of downtime with it. It's very expensive.
yeah,
So you know, it's tragic when you see it doesn't happen. I haven't come across it often, but I have seen where people have gone for hair transplants, and that disease process starts to attack the transplanted hair follicles. So that's why, you know, make sure that you go to someone who really can make an accurate diagnosis. Sometimes we need to do
mm,
biopsies, and
mm,
and often the case is that people have got a couple of diagnoses
yeah,
within their hair condition.
yeah. So I mean, I think that it just reminds me that a lot of procedures are done by people who aren't necessarily qualified in skin and hair, just like a lot of the other procedures available on our high street. So it's really important, again, to do your due diligence and check the qualifications of the person doing the procedure on you. Super, super important, and I can't stress that enough. Um, so what was I going to say? So, hair loss, for me, I feel it's a bit of a. I feel personally very strongly about the vulnerability of this group of people, because it can be targeted with marketing,
Yeah.
and hair growth serums seem to be something that we see a lot of on social media, and I find it really hard not to sort of go over to that page and be like, hold on a minute, but what's in this? How are you claiming that this is going to grow your hair?
Mm.
Um, but if you were to, if we were to create an ideal growth serum, and we're talking hypothetically, what would we include in it?
Well, I mean, I have for my patients. So, well,
So you've already done it. So there you go.
I mean, it's not rocket science. Like for women, topical finasteride and melatonin. So they give melatonin is the sleep hormone.
Yeah,
Your hair grows when you sleep, and they've been giving it to cashmere goats for many years to make their hair to make their cashmere yield increase. It's very safe to use
amazing.
topically. Finasteride as well. I'm not a fan of giving it orally. I know you can buy it online, but it's a very nice ingredient to use topically, and it works. And then plus or minus minoxidil. If I've got really kind of gung ho patients who don't mind shedding a little bit when they first start using it, they've got an option to add in the minoxidil up to
So
10%.
you have a specific one just with finasteride, and then one with minoxidil
So
and
one
finasteride.
right and melatonin.
Oh,
Um,
melatonin.
so those that's the one I tend to give for the teary women. So,
Okay,
yeah,
okay,
because
okay.
it's difficult because things with minoxidil can induce hair
Shedding.
shedding. The hair
Yeah,
cycle goes round in like 6, 7 years cycle. It grows,
yeah,
it rests, it gets kicked out. The hair follicles get kicked out, and then they
yeah,
start growing. Minoxidil encourages the resting hair follicles to get kicked out, and then they start growing again. So it's actually a really good sign when you get that shedding. But if you
yeah, yeah.
people are gonna, not cope with being at home after that consultation, and I've just been to see this derm and they told me to do this and now my hair's all falling out. But if you
Yeah, yeah.
some people will be like, yeah, no, no, if it's more effective, and it is more effective, then I'm willing.
Then go
uh,
for it.
yeah.
Yeah. So,
With
somebody just asked actually.
postmenopausal women, I haven't done this. If someone wants to steal my idea, go ahead. But if you add a bit of estrogen, that would help.
Topical estrogen.
But the reason why I haven't is because I don't want premenopausal women using it, because it's the type of
Right.
thing people would do, and because that increases the breast cancer risk. I'm
Of
quite
course. Yeah,
aware.
yeah,
Yeah.
yeah. And in terms of what are your thoughts on, and I think I get very enthusiastic about people talking about nutrition and hair and skin and overall, and gut health obviously seems to be very, very important these days. So what are your thoughts on nutrition and hair? Like, is there anything, I mean, I don't advise any specific diet for
Mm.
hair growth, okay, but and I'm sure you don't either, but is there anything that you've had thoughts about that's really kind of triggered some maybe potential um
Yeah, if you're anorexic or bulimic, it will affect your hair. You know,
yeah, right,
yeah,
of course.
that's something that you do see.
Yeah, we do see that.
Really, people should just live a healthy lifestyle and diet.
Yeah,
And I think people advise, with social media, anyone can give advice in this platform. So if you
yeah,
don't, if you're not medical, or if you don't have that level of expertise, you can
yeah,
advise what you have access to. And it's very easy to
yeah,
be like, yeah, go on this diet and it will sort your hair out.
yeah,
Or,
yeah.
I was trying to
I
explain it
think
about. It's not.
I think it's really I think somebody asked as well about sleep deprivation and hair
Mm,
loss. Now it all makes sense, doesn't it, really, when we think about um how much of our physiological process our sort of processes happen when we sleep. And if we're sleep deprived, obviously we're going to not produce, or the nutrients aren't going to get to the places where they need to. So eating healthily in the postpartum period is really, really important. And this isn't just a myth. You're South Asian, I'm South Asian. I talk to so many of my patients about how in the postpartum period, us South Asian women often aren't allowed to leave the house. And it sounds absolutely crazy when you put it into words, but it's all to do with healing, nurturing, and
a really I mean, my mother-in-law was really awful about what I was on. I wasn't allowed to eat anything. It was like this. No, and it was just like, and my parents visited me. I was in Japan at the time. They visited me at one month, and they were like, "What's happened to you? Like, not you haven't eaten in a month." It's like
oh,
all the
so
old ones
so
about what you can.
but there may be some truth in it, right? At some point. But I think that modern day woman has changed a lot.
Mm.
Our ways have changed a lot. Our lifestyles have changed so much, and so I don't know. I mean, I think my mum talked. My mum would make these like sweet things that had loads of nuts and other ground ginger and all of that sort of stuff that is helping healing and milk production and all sorts. And so
Iron
there is some truth.
is important.
Iron. So having a balanced diet, not taking anything out of context, and just trying your best to maintain nutrition is all you can
I have
do.
a about something related to this. Collagen
Yeah,
supplements there.
they don't.
No.
No, no. Yeah, we know that
I
though,
mean,
don't
I
we?
mean, the whole collagen supplement industry is. Don't get me started. We can do another live on this, but drinking collagen, drinking collagen
So,
does not replace the collagen that you lose in your skin or hair as you get older. It's
so yeah, no, and absolutely, and I maintain that on my because my husband and I both take collagen, but for other reasons. And it's not for hair growth, and I've maintained that. But you know, there is a lot of buzz about collagen. Even now, 2 or 3 years on, it's still being talked about. It
Mm.
will not help with hair growth, and we know
Yeah.
that. So finally, I think as we come to a close, this has been fantastic, by the way. I just thought I'd spring you a little question because I did brief you about what we talk about, but this little question at the end is, if is there anything in the hair or skin um, realm in terms of science and inventions or anything like that that really has excited you recently that you might have read or come across, or um, you know, somebody might have said?
I mean, I mean, you probably know that I was in Japan for a stem cell PhD.
Yeah, 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 I do.
I did it under the Nobel Prize winner that discovered how to reprogram somatic cells into embryonic stem cells, and then my
Yeah,
PhD differentiating them into the hair follicle. Now, that's exciting, but it's a long way off. And it
right.
really annoys me that companies have come out with stem cell treatments for hair that again don't work. And I can say this because I know a lot about that area. So again, it's like playing on people's insecurities for a
Yeah,
vulnerable
the vulnerability.
people, which is
Yeah,
yeah,
yeah. So stem cell research, and how far do you think we are from that?
a long way off. Yeah,
A long way off,
yeah,
but it's still exciting that it's somewhere in the pipeline.
yeah.
Well, look, thank you so much. This has been absolutely fantastic, and you know, I hope you enjoyed being grilled too. I know that the the listeners have had a great time because a lot of them have stuck around, and I'm really grateful for that. Thank you,
Thank you
Ophelia.
for
It's
having
been
me.
absolutely fantastic. I hope to see you off of Insta soon.
Yes.
And thank you guys. Go off and have a fantastic evening. And thank you for sticking around. See you later.
Good night. Good night.
Bye. Bye. Bye.